Welcome to our video on heart attack and stroke, especially uncommon symptoms. Even doctors sometimes get them mistaken for digestive issues or muscle pain. They are both part of cardiovascular diseases, and even symptoms sometimes look similar to an untrained eye. These are serious medical emergencies, and knowing how to avoid them and how to respond can make a huge difference. Let's start with heart attacks are the leading cause of death globally, causing an estimated 17.9 million deaths per year worldwide. That's a lot of people. But what exactly is a heart attack? Well, it happens when blood flow to the heart is blocked, usually by a buildup of fat, cholesterol, and other substances in the arteries. So, what should you look out for? The most common sign of a heart attack is chest discomfort or pain. But here's the thing, it doesn't always feel like you might expect. Some people describe it as pressure, squeezing, fullness, or pain in the chest. This feeling can last for several minutes or come and go. But chest pain isn't the only sign. You might also experience shortness of breath, cold sweats, nausea, lightheadedness, discomfort in other upper body areas like the arms, back, neck, jaw, or stomach. Some people might have all of these symptoms, while others might only have a few. Some might even have no symptoms at all, what doctors call a silent heart attack. Women, in particular, might experience heart attacks differently. They're more likely to have symptoms like shortness of breath, nausea or vomiting, back or jaw pain. These symptoms can occur with or without chest discomfort. Some uncommon heart attack symptoms can be subtle and easily overlooked, especially in certain groups like women, older adults, and people with diabetes. These atypical signs might not involve the classic chest pain, so recognizing them is crucial for timely treatment. Here are some uncommon symptoms. 1. Jaw, neck, or back pain. Pain that radiates to the jaw, neck, or upper back, especially if it's sudden or doesn't seem related to physical exertion. 2. Shortness of breath. Even without chest pain, feeling suddenly breathless can signal a heart attack, particularly if it occurs during rest or mild activity. 3. Nausea, indigestion, or heartburn. A heart attack can sometimes feel like stomach discomfort, including nausea, indigestion, or what feels like acid reflux. 4. Sweating, cold sweat. Breaking out in a cold sweat for no clear reason can be a sign of a heart attack. 5. Fatigue. Feeling extremely tired, even after simple tasks, can be a warning sign, particularly for women. 6. Dizziness or lightheadedness. Feeling faint or dizzy, especially when coupled with other symptoms, might indicate a heart issue. 7. Pain in the arms. Pain, discomfort, or tingling in one or both arms is a common symptom that might not always accompany chest pain. 8. Sleep disturbances. Some people report difficulty sleeping or a sense of unease in the days leading up to a heart attack. People with diabetes, especially those with neuropathy, might not feel typical chest pain during a heart attack, a phenomenon called silent ischemia. Being aware of these less common symptoms can be crucial for early intervention. Now, let's talk about strokes. Every year, more than 795,000 people in the United States have a stroke. That's about one person every 40 seconds. A stroke happens when blood flow to part of the brain is blocked or when a blood vessel in the brain bursts. To recognize a stroke, remember the word FAST. It's an easy way to check for the most common symptoms. F is for face drooping. Ask the person to smile. Does one side of the face droop? A is for arm weakness. Can they raise both arms? Does one arm drift downward? S is for speech difficulty. Is their speech slurred or strange? Can they repeat a simple phrase? T is for time to call the emergency number in your country. If you see any of these signs, even if they go away, call the emergency number in your country right away. But there are other stroke symptoms to watch out for too. Sudden numbness or weakness, especially on one side of the body. Sudden confusion or trouble understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, or loss of balance. Sudden severe headache with no known cause. Just like with heart attacks, stroke symptoms can be different for everyone. But they usually come on suddenly. That's why it's so important to act fast if you suspect a stroke. Now, you might be wondering, why is it so important to recognize these symptoms quickly? Well, here's the deal. Both heart attacks and strokes are time-sensitive emergencies. The faster you get help, the better the chances of survival and recovery. For heart attacks, about half of those who die do so within the first hour after symptoms begin. But prompt treatment can stop the attack and limit damage to the heart. For strokes, treatment works best when started within 3 hours of the first symptoms. Every minute counts. Prompt treatment can reduce brain damage and other complications. But here's some good news. About 80% of strokes are preventable. Maintaining a healthy lifestyle, managing conditions like high blood pressure and diabetes, and not smoking can all help reduce your risk. So, what should you do if you suspect someone is having a heart attack or stroke? The most important thing is to call the emergency number in your country immediately. Don't try to drive the person to the hospital yourself. Emergency medical services can start treatment right away, even before you get to the hospital. While waiting for help to arrive, here are a few things you can do. For a suspected heart attack, have the person sit down and rest. Loosen any tight clothing. If the person takes heart medication like nitroglycerin, help them take it. If advised by emergency services and the person isn't allergic, give them an aspirin to chew. For a suspected stroke, note the time when symptoms started. This is important for treatment decisions. Help the person lie down on their side with their head slightly raised and supported. Check if they're breathing. If not, start CPR if you know how. For both situations, stay with the person and try to keep them calm until help arrives. Now, let's talk about prevention. While you can't control all your risk factors for heart disease and stroke, like age and family history, there are many things you can do to lower your risk. Eat a healthy diet with plenty of fruits, vegetables, and whole grains. Exercise regularly. Aim for at least 150 minutes of moderate intensity exercise per week. Maintain a healthy weight. Don't smoke, and if you do, try to quit. Limit alcohol consumption. Manage stress through relaxation techniques or activities you enjoy. Get regular checkups and manage conditions like high blood pressure, high cholesterol, and diabetes. It's also a good idea to learn CPR. You never know when you might need to use it, and it could save someone's life while waiting for emergency services. Now, let's talk about heart attacks. It's crucial to know the early signs. The most common symptom is chest pain or discomfort. But here's the thing, not everyone experiences it the same way. Some people might feel pressure, squeezing, fullness, or pain in the chest. Others might have symptoms like shortness of breath, cold sweats, nausea, or lightheadedness. Now, if you think someone's having a heart attack, here's what you should do. Call the emergency number in your country immediately. Don't wait, every minute counts. While you're waiting for help to arrive, have the person sit down and rest. Try to keep them calm. If they're wearing any tight clothing, loosen it up a bit. If the person is conscious and takes any heart emergency medication, like nitroglycerin, help them take it. But don't give them anything else to eat or drink. It's also a good idea to give them an aspirin if advised by the ambulance or emergency call center operator. Chewing an aspirin can help reduce damage to the heart. But make sure to check with the emergency number in your country first. Keep a close eye on the person. If they become unconscious and stop breathing, you might need to start CPR. If you have an AED, automated external defibrillator, available, use it following the instructions. Now, let's talk about strokes. Every year, more than 795,000 people in the United States have a stroke. That's about one person every 40 seconds. Scary, right? But knowing how to spot a stroke can save a life. Remember the word FAST. It's an easy way to recognize stroke symptoms. F stands for face drooping. Ask the person to smile. Is one side of their face drooping? A is for arm weakness. Can they raise both arms? Does one arm drift downward? S means speech difficulty. Is their speech slurred or strange? Can they repeat a simple phrase? T is for time to call the emergency number in your country. If you see any of these signs, even if they go away, call the emergency number in your country right away. Other stroke symptoms can include sudden numbness, confusion, trouble seeing, dizziness, or a severe headache. If you suspect someone's having a stroke, here's what to do. Call the emergency number in your country immediately. Don't drive them to the hospital yourself. Ambulance staff can start treatment right away. Note the time when symptoms started. This is super important for treatment decisions. Help the person lie down on their side with their head slightly raised and supported. This position can help if they vomit. Check if they're breathing. If not, start CPR if you know how. Don't give them anything to eat or drink. This could lead to choking. Stay with them and keep talking to them calmly until help arrives. Now, here's something important to remember for both heart attacks and strokes. Time is crucial. The faster you get help, the better the chances of survival and recovery. About half of those who die from heart attacks do so within the first hour after symptoms begin. For strokes, treatment works best when started within 3 hours of the first symptoms. But here's the good news. Prompt treatment can really improve outcomes. For heart attacks, treatments like clot-busting drugs and stents can stop the attack and limit damage to the heart. For strokes, quick treatment can reduce brain damage and other complications. It's also worth noting that prevention is key. About 80% of strokes are preventable. Maintaining a healthy lifestyle, managing conditions like high blood pressure and diabetes, and not smoking can all help reduce your risk. Let's wrap this up with a few key points to remember. Don't ignore the symptoms or try to tough it out. Many people delay seeking help because they're not sure it's serious. But it's always better to be safe than sorry. Learn CPR. It could save someone's life while waiting for emergency services. If your workplace has an AED. AED is an automated external defibrillator. Know where the nearest AED is located in your workplace or community. Have a plan. Keep important medical info handy, including any medications you're taking and emergency contact numbers. Spread the word. Make sure your family and friends know these signs and what to do in an emergency. Knowing these steps could help you save a life, maybe even your own. Stay safe, stay healthy, and remember, when in doubt, call the emergency number in your country. Thanks for watching, and take care.